Welcome back. I am Dr. Lee of Practical Pain Management. It is one of the videos that show how much rotation and tilting I need to find a target and approach the needle. In this case, you will learn how to make an alternative approach when you fail to access the target of the facet joint. Maybe you will learn about being patient and steady. I will show you an inferior approach to the facet joint injections of both L4-5. It is an AP view. It shows a poorly defined border and sclerosis of the inferior joint margin of the facet joint. It looks challenging to me. It also shows transitional vertebra, Castalvi classification type 2A. I am not sure I will succeed in accessing the inferior capsule. Anyway, I will try the inferior recess approach first. But, first, I will draw an imaginary line of the inferior border of the facet joint of left L4-5 and make a target point below the joint line. How do I notice the successful popping into the joint capsule? The capsule is fibrous tissue and compact. So, when you penetrate the joint capsule, you will feel a sudden loss of resistance. But, if I sense only bony touch sensation without invasion enough, or the needle moves around freely in a minor manipulation, it is outside the osteophytes. You must set the target lower than the imaginary line of the I will clean the surgical site because I spent time multiplicating the germs. Let me go to the right L4-5 facet joint. It also shows a blurred inferior joint line. So, please give me a right ipsilateral oblique image, about 30 degrees of rotation. Now I can see a joint line. Again, just lower than the joint line is the target. Let me show you an AP view, and I will do a test contrast media injection. It is a contrast-filled arthrogram of the right L4-5 facet joint. I will fill the joint with 50 units of Botox and 15 milligrams of triamcinolone with 0.6 milliliters of 50% dextrose. Well done. Thank you for being so cooperative. Thank you for watching, and see you in the following videos.